Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hello, my name is Kelsey Zenti. I'm a P4 APPE student from the University of Iowa, and today I'm excited to speak to Dr. Nancee Waterbury, who has been a clinical pharmacy specialist at the Iowa City VA since 2001. She graduated from the University of Iowa College of Pharmacy in 2000 and completed the specialized practice residency in ambulatory care at the Iowa City VA in June 2001. Dr. Waterbury is currently the PGY1 Pharmacy Practice Residency Program Director. Her primary areas of clinic involvement include diabetes, hepatitis C, and virology. So welcome to the Pharmacy Leaders Podcast.
Thank you.
So let's start out. Everyone's leadership road is a little different. Can you tell me about where you started and how you got to where you are today?
Sure. As a young pharmacist, I was fortunate to be surrounded by excellent preceptors, and eventually those preceptors became my colleagues, and they were involved themselves at the local, state, and national organizations. They encouraged me very early to become involved and actually nominated me for several leadership opportunities within the Johnson County Pharmacy Association and then the Iowa Pharmacy Association. So with their guidance, I was able to serve in leadership roles for both of those organizations. And I've remained involved in both throughout the years.
Perfect. So you said that you were involved in the Johnson County Pharmacy Association and IPA as a pharmacist, but let's take it back to when you were in pharmacy school. What kind of professional organizations were you involved in there?
So I will say that the opportunities as a student now have evolved quite a bit from the opportunities that we had 15 plus years ago. So one of the organizations I was involved in was Kappa Psi. Okay. And then the other organization was Iowa Pharmacy Association. So I think now most students are in the Iowa Pharmacy Association kind of from day one, but that was not the case for us when we went through the College of Pharmacy. And so it was something that you had to seek out as far as going to their meetings, requesting to be on different committees and that sort of thing. So I think, from a student standpoint, I'm really glad that colleges of pharmacy have really expanded the opportunities for organizational leadership because those opportunities weren't as robust as when I went through school.
Yeah, that's great. And we are kind of automatically put into the IPA,
and that was a change
really
that
nice.
IPA made, actually. And I know we're going to talk about this in a little bit, but when I was on the board of trustees, that was actually a conversation that we were having of how to get more people involved.
Oh, cool. So you were actually involved in that process in
the beginning of that conversation, and how to get more students involved.
Yep. Oh, very cool. Well, like you said, you're still a member of the Johnson County Pharmacy Association. And, you mentioned that your mentors kind of helped guide you in that path. But you did serve as terms as vice president, president, and past president. So is your preceptors the main way that you got involved locally?
That's a great question. So as a resident, I had a preceptor, Dr. Kathy Reinhardt, and she was actually the president of Johnson County Pharmacy Association. As a resident, I had the opportunity to present at that organization, and our residents still today give a CE program for the local organization. And so once I graduated the pharmacy program, she was like, I think this would be a great opportunity. I'm still part of that leadership team, so I can help mentor you and coach you. Leadership has always been something that I've been interested in. So she nominated me. Honestly, it's not a very popular position for people, to want to serve just because it takes a lot of time. And so I was selected, and really with her guidance was able just to find out what local organizational leadership is all about. And things have changed throughout the years. We actually wrote a lot of grants to try to get funding so we could pay speakers to come in. That has since changed. But, I think trying to get pharmacists involved within the community to support your local organizations is challenging. And we've been very fortunate within Johnson County to still have a good following of pharmacists. And, it's interesting. It's not just pharmacists, it's technicians, it's retired pharmacists. We have students who come. So I think it's a good mix, of different people interested in pharmacy throughout Johnson County.
Yeah. And it's kind of nice, you get that mixed diversity of people, what their role is. And, they're all locals. So,
Absolutely.
They're readily accessible to talk to or meet with or that sort of thing.
And I like the fact that a lot of the residents within the Iowa City, Johnson County area presented these meetings. So I think it's good for them just to understand what local organizational leadership is about and have an opportunity to kind of give back to the community.
Yeah, absolutely. So not only are you active, at that local level, but you're also active in a state association, the Iowa Pharmacy Association, like we talked about. And you also participated in the Leadership Pharmacy Conference.
That's
so
correct.
What was that like?
So the Leadership Pharmacy Conference is actually a conference with both Iowa and Wisconsin. And they put on the conference every summer. You nominate young pharmacists to attend that conference. I was very fortunate to do that. It's a weekend. And it's really just a great opportunity to network, to meet other young pharmacists. They have kind of leadership, different activities, team building. They have a primary speaker who will talk about different leadership topics. And I think it's just a refreshing weekend. And their goal, obviously, is for you to take some of those skills that you learned and take it back to your practice site. And obviously to continue your involvement within that organization.
That sounds really cool. I'm actually going to the Student Pharmacist Leadership Conference later this fall. So I'm hoping that I can really build upon my, communication, leadership skills, kind of like you did, but, as a student pharmacist. So that's really exciting. You also won the Young Pharmacist of the Year award.
I did.
Can you tell us a little bit about what that is and kind of what that meant to you?
Sure. So I believe it's still pharmacists within their first 10 years of practice, and you had to be nominated by your colleagues. And like I said, starting here, as a young clinical pharmacist, I was very blessed to have some experienced pharmacists who had been leaders at both the local, state, and national levels. And I was fortunate that they, saw in me some leadership abilities. And so they nominated me for the award. At that time, I had taken on the responsibility of being residency director and, had done some publishing, had done some teaching at the college. And so I think just kind of the combination of my involvement also with the Johnson County Pharmacy Association, made my, the criteria pretty strong. So it was a great ceremony. They do it at the annual meeting where they announce the winners of all their awards for the year. And so you get to go up and thank the individual who nominated you.
Oh, that's really cool.
Yeah. So it was a great evening. And I just feel very fortunate to, in my young professional career, to be surrounded by such great mentors.
Yeah. And it seems like early on, you were getting involved in many different things. So
I was, but it's interesting. I think if you're surrounded by individuals who are involved, you yourself tend to be involved because that's just what is displayed for you. And so even though I've always enjoyed leadership and in high school, found myself doing leadership things, I really think it was just this environment that allowed me to continue that.
Well, that's great. So not only, are you staying involved in the pharmacy organizations, but obviously, you meet with patients on a regular basis. So you're a board certified ambulatory care pharmacist.
I am.
How does that board certification help you in your primary areas of clinic, like in hepatitis C and diabetes?
I think one of the challenges as you get out in practice is to keeping up with the literature, advancements in practice, especially maybe in those areas that you don't work in every single day. Obviously, our patients are complex. And so as a pharmacist, it's important to know a little bit about everything, right? And sometimes a little bit isn't enough.
Sure.
And so that's one of the great things about board certification is that once you become board certified, one of the ways that you can recertify that is to do your continuing education modules. And at the board certification level, those modules are peer reviewed. So it's not just like reading an article and answering some questions. It's a lot more advanced than that. And so I have found that to be very beneficial for me in keeping up with advancements in practice. I also like to use those modules not only for my own learning, but also for our students and our residents who rotate through here. And we can go, we have them read the module and then we have them answer the questions and just kind of work through some of the cases. And I think it's a good learning tool.
Yeah, it's kind of nice because sometimes when you think about the board certification, you think about that big exam at the beginning, but you don't realize, it provides you with so much CE and information,
Right.
through the rest of your
It certainly
career.
is a process, and individuals who take the time to become board certified, they've dedicated, their time to continuing to stay up to date with pharmacy practice.
Sure.
And so it's not just a one-time thing. It's something that, you need to continue to keep up. And I think that's a very positive thing as pharmacy continues to change.
Right. I mean, when I leave school, things are going to be changed, in the first year. So you got to constantly, keep learning. Well, so we mentioned that you are involved in the Hepatitis C Clinic, and I find that really interesting. Mm-hmm. Could you kind of walk us through what a typical day is like in that setting?
Sure. So Hepatitis C Clinic for us really became a standalone clinic after the approval of Harvani, which was in the fall of 2014. Prior to then, treatment really wasn't very good for our patients with hepatitis C. Long durations, not overly effective. But as people know now, for many patients, we are able to treat them with one pill once a day for 8-12 weeks. So I'm fortunate to work with, we have a multidisciplinary team with a physician, a nurse care manager, and then myself. My role is I review the patients that are coming into clinic, looking at all their patient characteristics. And so what other medications are they taking? What genotype of hepatitis C do they have? If we know that information, have they been treated before? How healthy is their liver? Is their liver non-cirrhotic, or do they have cirrhosis? So all those patient factors. And then before the patient's even seen, talking with the provider as what our treatment options would be if the patient is truly interested in being treated. Then our physician goes in and sees the patient, does a physical exam. And if the patient agrees to treatment, then I go in and do all the education, set up all the scheduling for our follow-up and all the labs. I see patients typically about every 4 weeks while they're on treatment, making sure that the medication is working effectively based on how their labs are trending. And then also just to make sure they're tolerating things okay, no new medications have been added. I would say probably the most rewarding thing is when you can call them and tell them that they've been cured of their hepatitis C.
Oh, yeah.
I mean, we've had people cry. We've had people screaming for joy.
Yeah.
It's something that these veterans, many of them have lived with for 30, 40, 50 years. And to be able to cure them of that now is pretty incredible.
And they probably didn't even know, that this was going to be an option, at any point in their life. So that's pretty amazing that you have, such a great impact on them.
For many of them, just a big relief.
Yeah.
Now that they have grandchildren, you'll hear stories of they don't want there to be any chance. And even though the chance of them spreading it would be very low, to them, that would just be devastating.
Right.
So to take that pressure off of them and, just give them the peace of mind that now they're cured is great.
That's really cool. So are you the only pharmacist that works in that clinic?
I am the only pharmacist that works in that clinic here. I know over the university, there are also pharmacists that work. And so it certainly has been an area of advancement for pharmacists to get involved. And, so as we talk about staying up to date with literature, prior to 2014, that really wasn't an area that pharmacy had a lot of involvement. But now you have complete practice areas that are pharmacist run or pharmacist driven. So we can treat more and more people with hepatitis.
Yeah. And it's so great that, the pharmacist has such an important role on that team.
Absolutely.
Obviously. So not only do you see, patients in clinic, but you're also the PGY1 residency director. So for our pre-pharmacy or even P1 and P2 listeners, why should they consider a residency? So what kind of informal and formal learning opportunities does a residency provide?
Sure. So I think it's easy to maybe consider a residency just another 12 months of rotations.
Right.
So much more than that. A residency really teaches you how to look comprehensively at a patient, gives you that confidence to make a solid recommendation. You'll get a full other year of being able to become familiar with the literature. So when you are maybe having a patient where there's a couple of different options, that you feel comfortable reviewing the different studies so that you can have a strong conversation with the team on what would be the best option. Because in many situations, especially in the hospital setting, there maybe isn't just one option.
Right.
And it takes additional training to really get comfortable with identifying what directions you can go down and being comfortable reviewing that literature to make a solid recommendation to the team. Other things that a residency gives you is you'll gain experience in research. You'll gain experience in understanding some of the behind the scenes that goes on with leadership in that healthcare system. All residents spend time with management teams. All residents are required to do a residency research project. And even though research may not be something that an individual is interested in pursuing long-term, just understanding some of the methodology that goes into research, I think really helps down the road in evaluating journals. When you yourself are trying to look at an article to see if it would apply to your practice setting or a particular patient that you're trying to make a good clinical decision on. All of our residents get experience developing continuing education programs, speaking in front of audiences, both big and small.
Yeah.
And also their writing skills. So if it's writing within the medical record or even, writing a drug class review, writing in their research abstracts and in their research papers. And so it's just another big comprehensive year. And I think the residents walk out of training with just a lot more confidence in knowing that they can make a difference on that healthcare team.
Yeah. And I think, obviously it gives you so many opportunities to learn and work with patients, but then you also are working alongside, mentors and preceptors.
Absolutely.
and that just kind of helps, them learn even more. So that's also another nice aspect of things. So you were once a resident at the VA and now you're the residency director. So you saw kind of two sides of the coin there. What do you see now that you didn't see when you were a resident?
So going back to your preceptors, as a resident, I don't think you can truly appreciate how important preceptors are. But as a residency director, our program would not be as strong if it wasn't for the preceptors we have. And very fortunate to have a large number of preceptors, people who have been here for as long as I have, very experienced. And then we also have some new young preceptors, which I think can relate to our residents and maybe preceptors who just graduated 2 years ago and understand what the residents are going through. Preceptors are so important for the mentoring and coaching of residents. And especially if you have a program that has dedicated preceptors willing to put that extra time in to help the residents learn is critical. And so as a resident going through, I didn't really appreciate that. Now that I'm on the other side, truly appreciate all the preceptors that we have.
Yeah. And now you see all the behind the scenes of how much work goes into just making things run smoothly and all of that. And, speaking of behind the scenes, when you're reviewing applications and conducting interviews, what kind of qualities in a candidate have you found necessary to be successful in your residency program?
So the residency is a long year. And I think the big difference between residency and going on student rotations is that many times in a residency, you're going to have projects that don't just end at week 5. Right. You don't have that final presentation, then you move on to something different. And so most of the time during the residency, you kind of have these lingering projects, presentations that you're working on behind the scenes. And so being able to multitask and being able to kind of put something aside, work on something else for a couple of weeks, come back to that is very important. And so having individuals who have been involved throughout their pharmacy school, been able to maintain good grades, maybe even work a part-time job, just shows residency directors and whoever else is on that committee that they've had opportunities to multitask and have been successful in doing that. Other things that I would say that we would look for are people who can self-evaluate and reflect. There's always going to be areas that residents are very strong in, and people tend to gravitate towards their strengths. But really, for a residency program, we want people to work on the areas that they're not so good in, the areas that they need to improve upon, so they can build confidence in those areas. So being able to be honest with yourself, to self-reflect on, I really need to spend some more time in the ICU because I'm not good there, even though I know it's going to be a really challenging 5 weeks. I think for an individual who's going into residency training, that's a very good trait to have because it's easy to be comfortable. It's hard to be uncomfortable, but you learn so much more when you make yourself uncomfortable.
Oh, yeah. And sometimes it's even hard to kind of acknowledge, okay, that's hard for me. Sometimes you just want to stay away from it versus, facing it head on. So,
that's right.
That's an important thing to just learn as much as you can. So I know that the VA system and licensure is very different. What makes your program unique compared to other residency programs out there?
So in the VA system, pharmacists have a scope of practice depending upon the areas that they're working in, their areas of expertise. So for example, I work in the virology clinic, in the hepatitis C clinic, and so I can prescribe all the antivirals for HIV and for hepatitis C. Whereas some of my colleagues, are working like in the anticoagulation clinic, or maybe they work up in our geriatric clinic. And so they have a different scope of practice. And so from a residency standpoint, our residents are working side by side with us and able to really learn from individuals who are practicing at the top of their game. And we can prescribe medications, we can prescribe labs, we make appointments, really working as a practitioner. And I think that's unique to the VA system. We don't have collaborative practice agreements. We are the pharmacist in charge.
Well, that's great. So, you mentioned obviously the scope of practice that the pharmacist has, but also the residents get kind of a good balance between the inpatient and outpatient experiences. So what would a typical day look for them? And I know that'll be different, depending on what time of the residency year it is, but I guess in general, what does a resident's day look like?
So if they are on like an inpatient experience, then every day they're in that inpatient setting, rounding with the team, going to meetings, giving maybe like a little in-service to the team. And as we mentioned, or as I talked about earlier, many times there's longitudinal projects or things they're involved in. So for example, once a month, our residents will have what we call a PEPPER program. So that's the teaching program for all the pharmacy residents in this area at the University of Iowa College of Pharmacy. And so one day a month, they go over for a noon session just to talk about different precepting topics. We also have like a project advisory board that meets like over the noon hour once a month. They're involved in different committees. And so usually I would say every day, every other day, there's some sort of noon meeting or something else that they will go to. Now, if they're in their ambulatory care kind of block, every day for them is a little bit different. And we try to make their schedule very similar to one of our schedules. So for example, my days are very different. Mondays, I do diabetes education. Tuesdays, I have virology. Wednesdays, I have hepatitis C. And so when we have a resident who's in like their ambulatory care block, then each one of their days is different. They may do anticoagulation clinic on a Monday, and then they may go to pain clinic on a Tuesday and primary care on a Wednesday, just so they get the feel of what it's like to be an ambulatory care clinical pharmacist.
That's really nice that, you mix it up even day to day. That way they're not kind of stuck in the same thing day after day, but, they're always having a new experience. So that's really great. So what advice would you give to a P4 student like myself who's, looking at residency, preparing for mid-year? Where should their focus be at when they get to that meeting?
So if you've never been to mid-year before, it can be extremely overwhelming.
Oh, yes.
It's a very big meeting. So much information and opportunities there. But in my opinion, if you want to get the most out of it, go in with a plan.
Okay.
If you have some specific programs or maybe areas of the country that you're interested in looking at, do some work beforehand to review those programs. Make sure that maybe you have a question for them. Every time that you talk to a program, think of it as like a mini interview. First impressions are important. And so you want to always make sure that you're putting on that professional face and so programs know that you're interested. There's lots of opportunities to network at the meeting. So besides the showcase, where the residency programs are on display, there's also opportunities to go to like different topics and different discussions. There's early breakfasts and late dinners and everything. Yeah. So it's a good opportunity just to kind of meet other people. But from the showcase standpoint, it can be very overwhelming. So I certainly encourage students to look to see on what day their particular programs are going to be there. Try not to cram too much in a day. And if you feel that you can't reach a program or, something happens and you are spending too much time with one program and don't get to everybody, have their contact information and reach out to them beforehand or even after the meeting, sending maybe a follow-up email. It was great to see you. Just want to let you know I'm really interested in your program.
That's really great. It's a good, advice to get it from your side and from your perspective, because as students, it's so intimidating. Right. There's so many people, so many things going on. So it's nice to hear that. So as we've kind of discussed, you're involved in so many different aspects of pharmacy at the VA. I mean, obviously, pharmacy is an enormous portion of your life. How do you separate work and home life?
So I have 2 boys,
Okay.
and they are very active in sports and different school activities. And so my husband and I really enjoy watching them in the evenings and attending whatever sport happens to be in season. I'm actually speaking of leadership, I'm on the board of their baseball organization.
Oh my goodness, you're everywhere.
It just continues.
Yeah.
And I also teach Sunday school. So it's nice because honestly, I feel as soon as I leave work, I flip the switch and I become mom. And then when I arrive to work, I flip the switch and, become pharmacist. And so it is very important to try to keep that work-life balance. I think sometimes it's easy as a young professional, especially if you're coming right out of school and you're used to studying all the time, to want to take stuff home and do that. But it's important to give time for yourself. Just so when you do come to work, you're relaxed, you're refreshed, and you're ready to go and, be able to give 110%.
Sure. Yeah, I think that's really important. You got to keep work at work and home at home. And that's, just the way it has to go. So my last question here is, what excites you most about the future of pharmacy?
As I was thinking about how far pharmacy has come since I graduated pharmacy school, I mean, there are so many just new concepts, new ideas, pharmacogenomics. That term didn't even exist.
That's kind of crazy.
In pharmacy school. So I think what excites me the most is just the opportunities that lay ahead of us. So much conversation about provider roles and the fact that I'm fortunate to work in a healthcare system that allows pharmacists to practice at the top of their license. In the years to come, I really foresee a lot more pharmacy-driven clinics, pharmacy-driven opportunities, hospitals really wanting pharmacists to manage, all the medications. And we're starting to see that with antimicrobial stewardship and having pharmacists involved in making sure we're not overusing drugs, and the pharmacoeconomic side, and making sure that when we do prescribe something that there is a reason for it, and it's not just something that stays on the medication list indefinitely. Right. So I just, pharmacy has come so far in the last 15, 20 years, and I'm excited to see where it goes from here.
Yeah, it is super exciting. And obviously, I'm getting ready to graduate, here in less than a year. So yeah, there's a lot out there. I know I've asked you a number of questions. Is there anything else that you'd like to talk about that we haven't already discussed?
I just think that the future is bright for pharmacy. I think there's a lot of opportunities. Obviously as a residency director, I think anyone who's interested in postgraduate training, you'll never regret that decision. Just because you complete residency training doesn't mean you have to go on and do a PGY2 or you have to go on and do research. I think anytime that you can advance your training, it just makes you overall a better pharmacist, a better clinician, no matter what practice setting that you're in. I think your network will grow tremendously if you are willing to get involved in organizations, and involvement doesn't always have to be a big time leadership position. Involvement can be going to an annual meeting, attending different committees, those types of things. It doesn't have to be being president or vice president, because depending upon where you're at in your life, that just may not be a possibility, and that's okay. Some of the best advice I had from one of my mentors very early was, I think there's a tendency to want to be involved in everything.
Yeah.
And the problem is that, yes, you can pay your dues, but you can't dedicate your time to everything. And so instead of doing that, pick one or two organizations that you feel passionate about and get involved in them. So it's not just paying your annual dues, but be involved, give back to that organization. And I've really taken that to heart. And so, like I said, my involvement specifically with Iowa Pharmacy Association is something that, I feel that they've given a lot to me over the years, and that now it's my turn to make sure I give back to them.
Great. Well, I thank you so much, and for all of your wonderful insight, and for joining me on the Pharmacy Leaders Podcast.
Thank you.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.